Dr. Brian Kinsel with the Fall Flagstaff. I'm going to show you my preferred technique to do some foam rolling of the quadricep. So this can be good to work through some trigger points that can come out in the quadricep. Sometimes can contribute to knee pain, to hip pain, or just overall general sense of tightness in the quad. So we're going to get a foam roller. Any type is fine. I'm actually get on one side of this guy, and I'm going to be rolling my right leg, so my left leg is off the side. I'm going to come onto my forearms. I'm going to start close to the knee. Not on the bone, but close to the knee. And what I'm going to do is I'm going to start rubbing or rolling side to side until I find a tender spot. So right there in my medial quad, the inside of the quad, I got a little tender spot. And then what I'm going to do is some small circles on here, but then I'm going to pause and do some knee bending and straightening. So mobilization with movement really takes us to another level. As I get the tissue elongating over this roller, we can really drive some blood flow, warm things up, hopefully make some change. I'm gonna do maybe 10 to 20 knee bending and straightenings over that tender spot. Might feel it start to release a little bit, and then I'm gonna hunt around for some other spots. And then right there, I got another one, bend and straight. And if I need less pressure, I can just come up onto my hands. More pressure coming back down here. And that one's pretty tender for me. Then I'm going to just work my way up another level. And again, side to side. And then I'll find a tender spot, bend and straighten. So I might spend 5 minutes a leg. I'm going to go all the way up to the top of the hip, because that's actually the rectus femoris, is a quad muscle, which crosses the knee and the hip, and get some bending and straightening there as well. So just a couple other points. A lot of times when people foam roll the quads, or anything for that matter, they just get on this thing and they kind of go to town real quick, up and down. I really want to slow down, and then I like to go side to side because the muscle fibers run up and down. And I just find if we go side to side, most people report they feel like they just get in there a little bit more. So I think we can drive a little more blood flow, get some of the tissues sliding over each other a little bit better. And then when we add the knee bending and straightening, the knee flexion extension, we get the quad elongating and shortening through a full range of motion. And just test it out and let me know what you think. The only places we don't want to roll are, of course, on any bone, and then also right along the lateral seam. That's the IT band. So the IT band is a piece of connective tissue that goes from the hip to the knee. So muscle has fibers that contract and relax. There's a lot of blood flow in there, and trigger points are a little microspasm in that muscle. The IT band is a connective tissue. It's like a ligament. So think of it almost like a zip tie that goes from here to here. So rolling that isn't going to do a whole lot. There's some studies that show you could hang like a car off of that thing and it's not going to change. So we're not going to do much to it with a foam roller. And in fact, most people, if we press on the outside of their leg, we kind of find a spot where there's not as much muscle tissue. Usually that's tender on everybody, and that's not going to change because that's just pressing through that connective tissue and then maybe down to the femur. However, the quads insert onto that IT band. They kind of come in here. And so I can roll all the way up to this edge, and often along this edge is where we'll find some of the most tender spots. And so just to show that again, I don't want to be directly on my side, but just maybe off to here. Showing this side. I don't want to be here, but man, I get right there. That's where that muscle comes in, and I'm going to scrub around, bending and straightening. Nice and slow, and then see how you feel.